If we have learned anything from this pandemic, it is that access to health care is critical.
Absolutely, but not all parts of North Carolina are created equal. Many of us in the Triangle opt to see a nurse practitioner rather than a doctor.
Well, tonight, only on CBS 17, Russ Bowen tells us there is an obstacle that some say is making it even harder for you when you need medical care.
COVID brought with it a lot of anxiety, anguish, and uncertainty. Those who had never struggled with mental health issues are now finding they need help. Therapist and nurse practitioner Jessica Sparrow has seen plenty of patients just like that.
Not allowing this bill to be heard has no benefit.
The bill Sparrow is referring to, known as the SAVE Act, is one she believes would increase access to care. It would take away the requirement for nurse practitioners who own their own business like she does to also have a supervising physician.
My supervising physician is great. We have a great relationship, but he's never been to this office before. He's never looked at any of my charts. He's not responsible for the patient care that I provide on a day in and day out basis.
Is it basically just a formality?
Yes. It's a formality.
Serves no purpose.
No, no purpose.
The supervising physician is only required to meet with the nurse practitioner twice a year, but they are paid for the whole year.
They can charge you whatever they want to, and we're talking big bucks.
Is this all about easy money for physicians?
There is a profit motive there that does not serve patients.
State Representative Gail Adcock has been a nurse practitioner for more than 3 decades. She says the added expense prevents people in her profession from adding personnel or expanding the business to areas where patients need care, particularly in rural areas with few doctors.
So a nurse practitioner that has to pay for paper supervision that does not add to the quality, the safety, or the outcomes of his or her patients is paying for something they do not need.
But the SAVE Act has gone nowhere in the House Committee on Health.
So what's the holdup?
So the real holdup is that there are powerful forces who have influence at the General Assembly who do not want to change the status quo. But it's physician organizations who believe that a change in the status quo upsets their business model and their revenue streams.
One of those organizations against the SAVE Act is the North Carolina Medical Society. It's donated thousands of dollars to one of the House Committee co-chairs, Dr. Kristen Baker.
Representative Baker, hey, it's Russ Bowen with CBS 17 News.
I'm so sorry. I have got to answer this call. I apologize.
Is there another time that we could meet up with you to talk about the SAVE Act?
Please reach out to my office.
I have. I've emailed and left messages, so she could. That would be great. Thank you.
Representative Baker is a physician, and the Medical Society is proud to stand with our physicians who like to run for office.
The SAVE Act has bipartisan support, but the Medical Society says ridding the need for physician supervision is not the right approach.
Spends more time focusing on independence for various nurse practitioners in settings to go off and kind of be on their own rather than partnering with physicians and other healthcare providers.
While Representative Baker never got back to me, her Health Committee co-chair, Larry Potts, did end up speaking with us.
I don't think it would be proper as the chairman of the committee to discuss the bill or give my opinion or position on it until it's scheduled to be heard by the in-committee.
Mental Health America says North Carolina dropped 38th to 44th in the nation in 2020 when it comes to access to mental health care.
This access to care problem predates COVID by decades, and it is not getting better.
Sparrow says it's not that difficult to help solve the problem no matter what a nurse practitioner's specialty is.
This bill is bipartisan. It saves the state money on healthcare expenses, and it increases access to care. It's a no-brainer.
Russ Bowen, CBS 17 News.